Rubicon First Aid Training, how to perform cardiopulmonary resuscitation, CPR. If after performing a primary survey, you find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone, so you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel beside the casualty's chest. Place one hand on the centre of the chest and place the heel of your other hand on top and interlock your fingers. This is to help lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest 5 to 6 centimetres. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing Staying Alive. After 30 chest compressions, you need to give rescue breaths. If you have not been trained or are unwilling or unable to give rescue breaths, continue chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers on the chin. Pinch the soft part of the nose and allow the mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest will rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there is someone who can help and has brought you an AED, ask them to turn it on and follow the instructions while you continue CPR.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Remove pads. Press pads firmly on skin. Apply pads as shown. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient.
Continue CPR until emergency help arrives or if the casualty starts to become responsive. They start breathing normally or you become too exhausted to continue. If they do start breathing normally again, place them in the recovery position and monitor them. Remember, if you come across an adult that is unresponsive and not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and ask them to bring an AED. If you are on your own, make the call yourself using a mobile on speakerphone so you can begin CPR. Give 30 chest compressions followed by 2 rescue breaths. Continue to give 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. That is how you perform CPR.